My name is Brian MacDonald. I graduated from the college in 2009. I grew up here in Rhode Island born and Rhode Island bred, and I currently live here in Kingston, Rhode Island, down the street from campus with my wife and my two kids and our Labradoodle. The reason I chose URI was basically, I think, my comfort with staying close to home. When I looked at colleges up and down the East Coast, as far as, Virginia and North Carolina, and then kind of working your way back to New England. But I was comfortable with campus. I liked campus. I'd been here, in the summer for camps and all sorts of activities. And so there was a familiarity there that I liked. And my parents just sort of reminded me that, if you don't come home, it doesn't really matter how far away you are in miles. I mean, it can feel as far away as you want it to be. So, I was comfortable with that. And we actually had a family friend who was a pharmacist. His name was Bill Ballou, and at the time he was teaching the compounding lab at the college. And so I was able to come down, take a tour of campus with him, learn more about the pharmacy program, and that pretty much, locked it in for me what I wanted to do.
Okay. Yeah, I'm actually, I was born in Narragansett and raised in Narragansett, so I'm also a local.
Yep, my wife is from Narragansett. Her parents live in Bonnet Shores, and we spent almost all of our summer there at the beach with my nieces and nephews and the kids.
Yeah, it's definitely not a bad spot, if I do say so myself.
You can't beat it.
So you're currently in the, say, specialty setting, is that correct?
Yeah, so it's a little bit unique, definitely specialty, but I am not a dispensing pharmacist per se in a specialty pharmacy. At Magellan, I help to manage sort of a suite of specialty clinical programs. So all sorts of clinical programs covering both drugs on the pharmacy benefit, so a lot of self-administered drugs, PO, subcutaneous medications, as well as drugs on the medical benefit, so often provider-infused, IV medications. And so we work to come up with a variety of management strategies, patient programs, provider outreach programs to help with sort of the ever-rising, trend of drug spend that is, focused in specialty conditions.
Okay. So as far as kind of like a typical work day, it sounds like it's kind of maybe a little bit more like project-based, like program development, as opposed to more like traditional pharmacy, like verifying orders.
Exactly right. So yeah, I mean, certainly our the specialty pharmacists who work in our Magellan Rx pharmacy down in Orlando are doing very much, the classic specialty pharmacy role of clinical verification, product verification, sort of similar to what you might see in a long-term setting, but, dealing with chronic complex conditions, things like multiple sclerosis, you're dealing with oncology patients, hemophilia patients, hepatitis C, HIV, cystic fibrosis, and then the whole bucket of autoimmune conditions like RA and psoriasis and Crohn's disease, just to name a few, that make up a large percentage of specialty patients as well. And so separate from the dispensing day-to-day operations, often specialty pharmacies will go with what they call, we talk about a very high touch model, which is assisting the patient from the time that the order comes in through the intake process, through the billing process, through the prior authorization process. And even after that shipment is set up, oftentimes specialty pharmacies will have patient programs to help sort of educate the patient, make sure that they're stable and confident and knowledgeable about their treatments. And those are the sorts of programs that I'm working on from a manager standpoint. In fact, we have one called MRx Cares. And so through our specialty pharmacy, we have a team of nurses who are trained in motivational interviewing techniques. And so they make outbound calls to meet with patients and discuss their new diagnosis, what their new specialty treatment might be, help with things like injection technique training if they need it, help with reminders and get, making sure that they're comfortable with their dosing regimen and whatever that might be, make sure that they have routine monitoring of their lab set up if they need it. And just making sure, like I mentioned, that the patient is confident and comfortable sort of embarking on this new care journey of theirs.
Right. Yeah, it sounds pretty unique. I know like kind of the managed care setting is a little bit similar where you're doing like a lot of projects, things like that. But it's cool to see how pharmacists are involved in different ways in all the different settings. You mentioned that in your programs, I know you mentioned like kind of helping train or maybe like design programs for nurses to help them kind of do what they need to do with the patients. Do you find yourself working with other types of healthcare professionals of different disciplines apart from nurses, just like on a regular basis, kind of just to, I don't know, in your workflow of kind of helping patients ultimately?
Yeah, absolutely. So outside of that one example of our, the patient program we run through the pharmacy, we have a team of clinical pharmacists, based out of our Rhode Island office who are helping to execute our other clinical programs around hemophilia or IVIG, or other, sort of medical pharmacy-based programs. In addition to that, we also, our team, the specialty clinical strategy team that I'm a part of, it helps to maintain what we call our expert clinical network. And so it's kind of a unique group of independent practicing physicians and specialists who are nationally and world-renowned in a variety of specialty and sort of rare disease conditions and disciplines. And so these are not Magellan employees, but they contract with us to help us review unique patient cases, provide second opinions, help with appeals and peer-to-peers on, on difficult, unique cases, and then also assist us with the creation of prior authorization criteria, medical policies, and provide sort of general drug info. So a lot of the requests from a variety of teams, whether it's on the pharmacy benefit side, the medical benefit side, our clinical drug info team, all kind of funnel through us, and have been able to work hand in hand with a lot of our key opinion leaders, these respected physicians, in getting their opinion on cases and specialty conditions.
Okay. Yeah, it's cool because, I mean, I personally have always enjoyed working with other people, and I think it's always interesting to work with other people who aren't pharmacists, just to kind of get new perspectives on things that you might not usually get. So
Totally agree. Yeah, I mean,
Yeah.
when I started right out of school, I worked in community pharmacy first for about 5 years. And, you certainly have that relationship with physicians' offices, primary care, offices and practices as the community pharmacist. And that, certainly has a certain level of communication, some offices better than others, and you can sort of build a relationship as you go. And then when I was looking to move out of the community setting, I did work in long-term care for about 3 years. And that was definitely sort of a step up because you're contracting with specific nursing facilities, assisted living homes, and you get to know the nurse practitioners, the physicians, the nursing directors in those specific facilities. And there's certainly a more established rapport and sort of a better comfort level there. And then, what I've been able to do at Magellan is definitely on the next level, because I mean, I never imagined that I would be discussing, these rare orphan disease states with, small patient populations and few treatment options with, these renowned physicians, and getting to hear their take on where the treatment landscape might be going, what their challenges are in the real world, and what we can do to sort of assist.
Right. It definitely seems like a pretty, I guess, unique and like valuable thing to be able to do. So how did you kind of initially get involved in specialty pharmacy?
Yeah, it was sort of, most of my stops along the way boiled down to networking and the relationships that I made through the college. And so, when I came out of graduation and went into the community, I was helping to, manage retail pharmacies in the Southern Massachusetts area, which was great. But being a Rhode Islander, I knew I wanted to sort of get back to Rhode Island eventually. It's where my wife and I wanted to establish our roots and get back to. And so when the opportunity came to look at the long-term care, that was really because I already had a couple friends, through the college, that were working there, who were sort of recruiting me and saying, hey, you should come check this out. It's great. It would be a nice, quality of life move for you. Try something different. And so those connections that I made through the college and through Capacai, helped me to sort of, feel comfortable taking that leap into long-term care, which in honesty wasn't something I was totally familiar with or really knowledgeable about, but helped me make that leap, and was a great stepping stone. And I really enjoyed my time there, and it was different, and it worked for quite a while. But then, once my daughter was born, the nights, the weekends, the holidays, the on-calls started to, become old hat. And so, again, looking for a quality of life move, it was really the same script. I had a lot of friends and Capacai brothers who were working at Magellan, and same thing, talking about how much they were enjoying it, think the change of pace, the routine and everything. And so that sort of encouraged me to want to go check it out. And all that is to say, I got a job in our clinical service center in the Newport, Rhode Island office, working on our clinical programs as a clinical pharmacist, making outbound calls to patients to help with some of our adherence programs. And as I kind of, got more seniority under my belt, I got the opportunity to sort of dabble in one of our first specialty programs, which was reviewing prior authorization cases for IG, so like immune globulin cases, reviewing the chart notes, reviewing the labs for, very interesting immunodeficiencies and neuromuscular autoimmune conditions. And so that was sort of the way the door cracked open for me. And then when there was an opening on the program management side to start managing some of those programs and creating new offerings for our clients, I jumped at the chance to do that. And, it wasn't a deep specialty experience that I had, but, I thought, the relationships that I made coupled with enthusiasm and sort of an eagerness to learn was enough to sort of help me get through the door.
Right. Would you say any of your previous experiences, either with kind of retail or long-term care, helped you kind of acclimate to the new setting of like managed care / specialty? Or were there any like maybe skills that you had that you feel helped you along the way to become familiar and learn your way through specialty pharmacy?
Absolutely. I mean, there's certain things that I think are universal. So I mentioned the enthusiasm, the willingness to learn, the willingness to try something that is maybe a little bit outside your comfort zone. I think that's where you really kind of learn what you are capable of, or what what you're willing to take on. That said, from the community, a lot of that is so much ingrained in, obviously, in customer service, in patient relationships, in communication back and forth, and being able to partner some of those soft skills with what was sort of an evolving clinical base as we moved from community to long-term care to specialty. Learning more and more about the treatment regimens, what's there, just constantly getting those reps in the practice to be able to carry that over from role to role.
Right. Let's see. Have you seen like the role of pharmacists in the setting of specialty? Have you seen it like evolve since you first got into it, or do you see it kind of continuing to evolve so as like pharmacists are becoming able to do more and more things that they weren't maybe able to do in the past?
I definitely think so. I mean, when I first joined the specialty clinical strategy team, we had sort of a smaller menu of programs. We had the IVIG program that I talked about. We were just starting a hemophilia program where pharmacists were going to be interacting with providers and hemophilia treatment centers of excellence and specialty pharmacies to work with them on inventory management and assay management and dispensing of factor products to patients. And we started to evolve our offerings. I definitely have seen sort of a shift from the pharmacy benefit, those self-administered meds, more towards the medical benefit. I think that's where a lot of the new approvals are coming out, a lot of IV medications that come with high price tags and a lot of sort of opportunity for management and kind of monitoring of patients who are going on these therapies. Obviously, treatments are becoming more and more advanced with genomic testing and the ability to sort of pair the right drug to the right patient based on their genetic code. So I think that is sort of the next horizon that can really kind of explode how pharmacists are used to look at treatments, not just based on their indication or their dose, but really is it clinically appropriate for this particular patient. So as those come around, with gene therapies becoming more and more common, some of the medical advancements have just been amazing to see, and for pharmacists to be right there to collaborate, to give their opinion on not only its use, but how it compares to other products in a similar category, and help with kind of coming up with some of that cost-based sort of comparison of efficacy. There's certainly a lot that our clinical knowledge base can be used for beyond the traditional skill set.
Right. Yeah, it's something that I think has come up a couple of times where like a lot of the new things that are happening in maybe healthcare as a whole are new medications that are coming out, and pharmacists seem like some of the more apt to pick up on the changes and where things might be used. So definitely a specialty setting, I can see like pharmacy being very valuable, and it certainly sounds like it is already.
Yeah, totally agree. I mean, Magellan, I think makes great use of the pharmacists that it has in-house in various levels of management. There's plenty of advancement within the company, for pharmacists, and our opinions, I think, are very much valued as part of, outside of managing our individual programs. Our team is often participating in presentations from pharma and manufacturers about new drugs that are coming to the market, what their pipeline looks like, what their clinical trials are that are in the works, and being able to digest, all of those kind of new frontiers as they're coming up with new treatment modalities, new routes of administration, new novel mechanisms for drug delivery, and being able to sit and participate in all that really is, been an eye-opening experience. Being able to watch as, the CAR T therapies have come to sort of revolutionize how certain cancer patients are treated has been really, neat to be a part of.
Right. Do you have a kind of favorite or most exciting aspect of specialty pharmacy that like you enjoy particularly the most?
That's a great question. I would say probably what I've been able to do with our expert clinical network, with those expert physicians that I mentioned before, being able to work hand in hand with them on really like the toughest of the tough patient cases, where our health plan payer clients are coming to us and saying, we've got a doozy, we're not even sure what to do here. The treatment guidelines might be vague or absent for this, for this rare condition that has very few patients, or there's really no consensus around what the best treatment option is for a patient like this. What should we do? And being able to sort of take that information from the client, package it up, work with our key opinion leaders to review the case, and then be able to sort of relay their recommendations and their evaluations back to the client in a client-ready professional package is probably one of my favorite things that I get to do.
That does sound very cool. I mean, I personally have always been a big fan of like working in teams and working with other people. So it definitely sounds like something that would excite me as well.
Yeah,
It's exciting to hear about.
Yeah, our team definitely has the ability to work with other teams, other departments outside of being siloed, because of the variety and sort of the diversity of our program offerings. We're constantly collaborating with the sales team on the pharmacy benefit side, the sales team on the medical benefit side, the clinical service center, and the teams that are actually executing the programs, the clinical drug info, people who want to know a little bit more about certain specialty drugs from us. There's a lot of opportunity for collaboration.
Right. How would you say that URI has prepared you? I'd say for your role in specialty pharmacy, but you can kind of, if you would like to kind of generalize it for your whole career path at this point.
Yeah, so I mean, I think my career path has been atypical. I did not do a residency. I did not sort of find my focus per se and really go after it in a linear sense. I zigged and I zagged, and I made returns from community to long-term care to managed care, and now managed care focused on conditions. But I don't really regret any of it. I think it was all valuable experience along the way. And what I think I got the most out of from my URI pharmacy experience was, again, a lot of the networking, a lot of the relationships that enabled me to take this circuitous route to a role that I really love to do now, both with my peers in the student groups and in Kappa Psi, but also with the professors. I mean, there were so many professors who were so giving and so personable and so willing to build relationships with the students, that I think that overall enthusiasm that I had for the college was able to propel me into an enthusiasm, for my professional career.
Right. And I can speak to that as well a little bit. It's a relatively small class size. It was like roughly around the size of my high school graduating class, which was also small because I'm from Narragansett, but it does create kind of a closeness amongst the whole class, and everyone's kind of there for each other. It's nice to feel that you have people to lean on when you need it.
Yeah, I mean, I totally agree. I mean, we came up in the old Fogarty building, but it was amazing to come back for the ribbon cutting at the new building. It's magnificent. It's not a coincidence that my wife and I chose to, purchase a home here in Kingston and live basically across the street from campus to be able to go out and take a Saturday morning jog around campus and sort of still take in the life of the community be able to go to basketball games, be able to be a part of it is still great. And I've watched enough, similar interviews with other alumni to know that, name dropping is okay. So yeah, the relationships with Dr. Orr, Dr. Ferret, Dr. Bratberg, Dr. MacDonald, and so many more, Dr. LaCroix. I mean, those relationships are really what, had me energized and ready to go out and sort of, put patients first.
Right. Totally agree. I think we addressed most of the questions that I wanted to get to. If there's kind of any closing remarks you want to make about specialty pharmacy, or just kind of any advice you would want to impart upon, maybe like a high school senior who's considering pharmacy or considering URI, I'll kind of open the floor to any of that.
Yeah, I think there's a couple things that I would mention. I think first, the idea of specialty is only going to continue growing. I think specialty got its name because it was a small percentage, a small niche of drugs and conditions relative to the broader healthcare landscape. With every passing year, that small niche is becoming larger and larger, to the point where I think most recent trend reports and pipeline reports would show you that the vast majority of new drugs being approved would be deemed specialty drugs, for specialty conditions, orphan diseases, things of that nature. And so, getting an early interest in those conditions, I think, will open up some opportunities, hopefully, for students, because, certainly there's more and more treatments focused on those conditions that are coming to the market. For anyone who is particularly interested, I know, our Magellan rotation has been a great success and a great collaboration with the college in the past, but we now have a specific specialty rotation. So you can come work with our team. I'll be your preceptor, whether that's a good thing or bad. We'll let the first few students decide, but it is available now as an elective. So anyone who's interested in specialty can come to Magellan and dedicate some time learning about our programs and the categories and the conditions that we support.
Awesome. Any advice for a either newly admitted URI pharmacy student or someone who might be considering URI?
I mean, I have absolutely no regrets about my time at URI. I was so glad to have had 6 years instead of just 4 and being, sent out to the real world. So, I mean, the 0 to 6 track was fantastic. I loved every second of being there, and I would highly encourage anyone to consider, applying and then ultimately, pursuing the career and specifically in education through URI.
Right. Yeah, it's funny because when I first, at least for me, when I decided that I was going to do the 6-year program at URI, you think of yourself as I was class of 2021, and it feels like you're never going to get to that point. It just feels so far in the future. And then now I'm here in 2021 finally. But I do agree that having the extra 2 years is really great. And I think that I feel very prepared for what's to come. So I'm very happy
Absolutely.
with the decision I made as well.
Yeah, the college has, sets people up, as more than prepared for what is to come.